This week, we'll be discussing behavior therapy, and in this lecture, we'll talk about some of the key concepts of behavior therapy. Behaviorism developed very much as a reaction to Freudian psychoanalytic therapy and other types of therapies that came before it that focused on internal, unobservable phenomena. So if you think back to psychoanalytic therapy, it's very much focused on things that are unconscious motives and drives and conflicts and things that you cannot see. And so the behaviorist said that if psychology was going to be taken seriously as a science, we had to focus on things that you could observe and measure. So this type of therapy focuses on directly observable behavior. It focuses on the current determinants of behavior. So rather than looking to your past or your childhood for reasons for your current behavior, it says what in the here and now is maintaining that behavior. There's a focus on learning experiences and how those experiences can change your behavior. This type of therapy tailors their treatment strategies to each individual client, and there is rigorous assessment and evaluation. So if you're looking for behavior change, you have to assess and measure and evaluate that change in behavior. So one of the theorists that we associate most closely with behavior therapy is B.F. Skinner. And he didn't deny the existence of internal processes, but he said since we have no way to observe these internal processes, they should not be the focus of our treatment. We should focus on environmental factors and observable behaviors. So some of the key concepts of behavior therapy. Again, we focus on clients' current problems and factors that influence those problems today rather than past determinants of the behavior. We look at the current environmental events that maintain behavior. So what in your current environment is contributing to the maintenance of this behavior problem? And then from that, what factors can be used to modify your performance? There's a focus on changing behavior, so we have to look at what factors in the environment we can modify to change your behavior. And behavior changes can occur without insight. So you don't have to understand why you have this problem. You don't have to understand how it developed in order for you to change your behavior. There's an emphasis on careful assessment before beginning and throughout therapy. So if you're looking for behavior change, you have to get a baseline measure of behavior. You have to know the level of the behavior before intervention starts. And then throughout therapy, you're going to continue to assess and evaluate that behavior to see if the behavior is in fact changing. And goals are going to be stated in a concrete, objective way. So a goal for behavior therapy wouldn't be the client will be less depressed, because that is not, it's not concrete, and you can't really measure. How do you measure how depressed the client is? So a more concrete measure would be currently the client is so depressed they're only leaving their room 3 days a week. We want to increase that from leaving the room 5 days a week to increase it from leaving your room 3 days a week to 5 days a week. So that is much more easily measured. If the client is scoring at a certain level on some measure of depression, we can say we want to decrease their score on this depression measure by X number of points. So you want to be very concrete and clear in how you're going to measure your behavior change. So there are 4 key areas of development within behavior therapy: classical conditioning, operant conditioning, social learning approach, and cognitive behavior therapy, or CBT. So classical conditioning is focused on associations that we create between various stimuli. And this comes from Ivan Pavlov's famous dog experiment. I'm sure all of you are very familiar with this, but let's do a quick overview of this experiment. So Ivan Pavlov was doing an experiment on dogs' digestion. So he would present dogs with meat powder, and then he would measure how much they salivated once they were presented with the meat powder. Over time, he realized that the dogs were salivating even before the meat powder was produced or introduced to them. So they would just hear the experimenter come into the room who's going to bring the meat powder, and they would start to salivate. They would see the bowl that the meat powder was presented in and start to salivate. So Pavlov began to realize that these animals were somehow making a connection between the meat powder and other things in the environment. So then he began ringing a bell before he fed the dogs. And over time, the dogs made an association between the food and the bell, and he could just ring the bell and the dogs would salivate. So in Pavlov's experiment, the neutral stimulus would be the bell. It's something that's neutral, that doesn't really cause a reaction in the animal until it's paired with the food, which is the US, or the unconditioned stimulus. The unconditioned stimulus causes an unconditioned response. The unconditioned response would be salivating. So the term unconditioned means unlearned. So the animal did not have to learn to salivate to the meat powder. It was a natural reaction. But over time, with pairing that bell with the meat powder, there became a learned response, a conditioned response. So the bell that was once neutral becomes a conditioned stimulus, a learned stimulus, and it brings about a conditioned or learned response of salivation. So classical conditioning can explain many things, such as aversions. So if you ate a particular food and you got sick later, you may learn or develop an aversion to that food. It can explain phobias. If a particular location was associated with some type of trauma, then you may develop a fear of that location or a fear of that thing that was paired with the trauma. It can also explain depressive symptoms. For example, if on a certain date, someone that you were very close to passed away, when that date comes around or when that date approaches, you may experience some depressive symptoms because you've classically conditioned or associated the date with that loss. And so we can use classical conditioning to treat behaviors in a number of ways that we'll discuss later, like flooding, for example. Another major part of behavior therapy is operant conditioning. And so whereas classical conditioning behaviors are told by something in the environment, they're elicited by something in the environment, operant behaviors are behaviors that are influenced by the consequences that follow them. So it's the consequences that follow the behavior that determine how likely the behavior is to occur again. If the behavior is followed by reinforcement, then the chances that behavior will occur again in the future are increased. If the behavior is followed by punishment, that decreases the likelihood that the behavior will occur again in the future. So operant conditioning is used to treat behaviors in a number of ways. Things like token economies or reward systems where you earn tokens or points for appropriate behavior. Punishment, of course, is used to decrease behaviors in lots of settings. Sometimes people punish children, they'll spank children, they'll remove privileges to try to decrease a behavior that the child is showing. Social learning approach, and this was introduced by Albert Bandura. Social learning approach is also called social cognitive theory. And this theory says that there is a reciprocal relationship between, and forgive me for this little error on my graphic, there's a reciprocal relationship between the environment, individual behavior, and personal factors. And so personal factors are internal factors, things like your feelings, your beliefs, your perceptions, your expectations. So those are the internal personal factors. And Bandura said that each of these factors influence each other. So you notice the arrows in the graphic are going both ways. That means that all of these different factors can influence each other. So take, for example, if you are going into an interview and you expect not to do well. So that's an internal personal factor. That's your expectations about the situation. So because you don't expect to do well and you don't have that sense of self-confidence, that may manifest itself in your individual behavior. So when you go into the interview, you may not make eye contact with the interviewer. Your hands and your voice may shake. You may appear nervous. And then your individual behavior could influence the external environment. So in this case, the external environment would be the interviewer. And because the interviewer sees that you are nervous, your hands are shaking, you're not making eye contact, the interviewer may perceive you to be an incompetent candidate, and they may treat you more harshly. And then that may go on to influence those personal factors. It then decreases your confidence even more. So all of these different things can influence one another. An example of it going the other way, and instead of your personal factors influencing your individual behavior, if you go into an interview and you make eye contact and you smile and you make yourself appear confident, that may then influence your personal factors and you may actually begin to feel more confident. So you kind of put on the facade, you behaved as if you felt a certain way, and because you're showing those behaviors, you then internally begin to believe that. And so we use this social learning approach. We do things like, well, let me say, you can change your client's behavior by influencing any one of these three areas. You can change their environment to change their behavior. You can influence their individual behavior, again, like teaching things like social skills, teaching things about appropriate interview behavior and dress. So you can influence that area, or you can also try to influence those personal internal factors. So you can influence the client's behavior by intervening on any one of these three areas. And finally, cognitive behavioral therapy, or CBT. So this is a very popular theoretical orientation among psychologists. And this says that what people believe influences how they act and feel. So if you think back to that last graphic, the idea that you can change those internal factors, you can change your belief systems, you can change your perceptions, and that will change how you then act and feel. And so from this perspective, the mechanisms of change are both cognitive and behavioral. So you're not only focusing on changing the client's behavior, you're also changing those cognitive factors, those internal factors, how they perceive things, what their beliefs are about things, and those things in turn can also change their behavior. So some of the strengths of behavior therapy from a diversity perspective. There's an emphasis on brief interventions. And so this can be beneficial for clients from diverse backgrounds for a number of reasons. Number one, the brief interventions may better fit with their sort of value system and their idea that therapy should be about, solving problems in a quick way. And also just for monetary reasons, a brief intervention may be, more financially feasible for them. It teaches coping strategies and problem solving. So again, this may play well to clients who believe that, I come to therapy not to gain insight, not to spend years exploring my emotions, but to find a solution for a particular problem. It also focuses on environmental, social, and political conditions that contribute to a client's problem. So you're not solely focused on the client, you're also focused on those environmental factors that can be contributing to and maintaining their behavior. On the other hand, there are some shortcomings from a diversity perspective. Some counselors may use a variety of techniques in narrowly treating specific behavior problems. So rather than looking at the big picture, there could be something that is contributing to many different behavior problems. But because the focus is not on gaining insight into what is causing the problem, the counselor may then narrowly treat individual behaviors. So they're trying to address the behaviors, but not the thing that may be contributing to many behaviors. So their view may be too narrow. And then instead of focusing on those contextual issues that we mentioned, society and politics and environment, they may focus only on the individual problem. So they're, again, narrowly focusing on treating individual behaviors. They're looking at, what is quote unquote wrong within the client, but they're not looking at the things in the client's context and their environment and society and culture that could also be contributing to their behavior issues.